My name is Erin Caudle, and this is my health assessment video. This is Jen, our patient today. Um, I've already had Jen empty her bladder and put on a hospital gown. I have washed my hands. We did a full set of vital signs, height and weight, and near and far vision tests have already been done. So initially I'll just start by kind of looking Jen over in general, making notes to myself as to um, if she's well groomed, what her gait looked like when she came in, um, the symmetry of her body. And I'll look a little more closely, starting with the head. I'm going to look at the symmetry of her facial features. I'm going to look at her head, her skull, and see if I notice any kind of masses or bumps. I'm going to touch her hair here, and I'm going to make note that it's soft, even hair distribution. We'll go ahead and check her skull for any masses, lumps, or any kind of lesions. We'll look at her eyes. We want to note that they're symmetrical, that her eyebrows are symmetrical, with even hair distribution. Eyelashes are distributed evenly on the upper and lower lids. There's no ptosis present that we can see. And then we'll go ahead and do a more in-depth eye exam. We're going to start by we'll start by doing the extraocular movements. And to do that, we have the patient look straight ahead and ask, Jen, please don't move your head, but follow my finger to all the different points, okay? And her extraocular movements are intact. Next, we'll look for pupillary light reflex. We want to look in each eye with a light, and we also want to look for accommodation of the other eye. So if you look straight ahead, I'll shine a light. And you want to do that for both sides each time. You can also, while you're doing that, make note of her sclera. Her sclera should be white, hers is. Look at the conjunctiva, should be pink, and hers is pink. Next, we're going to test her peripheral vision. If you will cover one eye. Alright, and now I want you to tell me when you can start seeing my finger, okay?
Now.
Okay, and then we'll test the other eye.
Now.
Okay, good. We're also going to do the cover-uncover test, so if you'll cover one eye, either one, and look at this point straight ahead here, and then uncover. Perfect. And the other side. And uncover. Perfect. Thank you. Next, we'll take a look at her ears. We want to look for the symmetry of the ears. We want to look at the height of the ears, any masses, lesions. We'll go ahead and palpate them, the auricles. Nothing is noticed there. We'll go ahead and take a look inside. We're going to look at the ear canal and the tympanic membrane. And it is pearly gray. All the landmarks present. Looks great. You want to do that for both sides. While you have the light, you can go ahead and take a look at her gums and her teeth. You're looking for what kind of repair her teeth are in. You want to look at her tongue. You're looking for asymmetry. Looking at the fissures. You always want to do screening for oral cancer, so you're going to look all around underneath. Look at the uvula, tonsils. You want to make note of what kind of repair her teeth are in. Look underneath, look at the floor of her mouth. Thank you. Perfect. All right, and everything looks good there. We can go ahead and test sensation on her face, part of the cranial nerve test. Use just a little bit of cotton here. I want you to tell me if you can feel this, okay?
Mm-hmm. Mm-hmm. Mm-hmm.
And you'll do that on both sides.
Mm-hmm.
And you can also do it, this is with soft touch, you can
Mm-hmm.
do it with like a pin for a harder touch. We want to go ahead and make note of her nose, that it's straight, and you want to look at her septum, make sure it's not deviated. You can have her occlude one nostril if you have closed one, and take a deep breath in. Good, and that way we know it's clear. Any problems breathing through that nostril? Okay, go ahead and do the other one. Perfect. While you're doing that, you can always do the smell test. Make sure the person can identify an odor with their eyes closed with each nostril. Another one of the cranial nerve tests. We're looking for any kind of swelling of the sinuses. So you're gonna go ahead and palpate your sinuses here. And you want to check out the lacrimal apparatus and the facial bones. You can go ahead and check the sinuses or the lymph nodes in the neck here. Your pre-auricular, your post-auricular, occipital, cervical chain, subclavicular. You want to check the mandibular, submandibular, submental. You want to check jaw movement, those muscles, and also in the temple area. You want to have her smile, showing all of her teeth, frown, puff out her lips, cheeks, raise her eyebrows. All of those things you're looking for symmetry, and you're testing the more cranial nerves. Next, you want to check out her neck, so you're going to check for range of motion. If you will just put your right ear on your shoulder and then to the other side, back and forward. And now you want to do it against resistance, so I'll just have you do the same thing again. Perfect. Other side, back, and forward. Great. And shrug your shoulders, looking for symmetry there. Again, perfect. You want to take a look at her neck in general, make sure that it's straight and symmetrical. You want to look for the trachea, make sure it's midline. You can feel for that. And then you want to also feel for the thyroid. And you can have the person swallow. Perfect. Thank you. All right, and then we can go ahead and move on to listening, palpating and listening to the carotid arteries. So you want to check the carotid arteries, but one at a time. It's freezing. Great. And then you're going to use the bell of your stethoscope to listen. You're going to have the patient hold their breath while they do. Check the other side, take a breath and hold it. Good. And then you also want to listen to the thyroid to make sure you don't hear any buoys. You can then move on to the upper extremities. So you want to first palpate. You're looking for muscle mass, looking for swelling. You want to look at their skin. You're looking for lesions, looking at the color. Should be a good, healthy pink color. She obviously has a tan. Look at the veins, the nails, capillary refill. And then next we can move on to her back. And I'm not sure, should we have you?
I can do it.
Okay.
You can listen to me.
Yeah. That's fine. So you would want to be behind We want to be behind the patient, preferably bare skin, so she has on a hospital gown, remember. We're going to look at her skin. We're looking for any lesions or anything. We're looking for muscles. We're looking for symmetry. You want to check um, the expansion when she takes a breath in. And you would do that by placing your hands on her lower back and having her take a deep breath and watching if your hands move symmetrically. You'll also want to go ahead and listen using the diaphragm, and you want to listen, having them breathe in and out, listening the whole time and comparing side to side. You would also want to go ahead and percuss. And when you percuss, you can go ahead and look for the diaphragmatic excursion. So we just do direct percussion, comparing side to side. And then we can also check for tactile fremitus. We can have her say 99,
99, 99, 99, 99.
and check all the way down. Then you can go ahead and move to the front. Again, you'd have a hospital gown on so you could see her skin. Check for all the usual lesions or anything like that. You want to look for any pulsations, heaves that might be present. You want to look for pericardial thrills. You can go ahead and percuss the front as well. And also do palpation, looking for any masses or anything, and do the tactile fremitus again. So, and then you would want to go ahead and auscultate. You want to auscultate all of the cardiac positions. So you're listening to all the different valves. We are going to defer her breast exam right now. We can go ahead and check axillary lymph nodes here. Looking for any swelling, any tenderness, of course. Next, we can move on to her abdominal assessment. Have the patient lay down in the supine position. It's important to listen first before you do any kind of palpation. There we go. Okay, good. I know where you can see it. All right. So first, just an observation. You want to look and see, is the abdomen flat, concave, rounded, and then you want to go ahead and listen to the 4 different quadrants. You're listening for vowel sounds in each one. Listen up to 2 minutes. If you don't hear anything for 5 minutes, then that's an ominous sign. Good. You want to go ahead, while you do, you can go ahead and listen for the aorta, abdominal aorta, and the femoral arteries. Then you do light palpation, and this is for looking, you're looking for tenderness basically before you do any kind of deep palpation. Any tenderness in your abdomen? No. You can go ahead and do percussion as well, and you can tell there's a different sound over the organs than over the rest of the abdomen. And you can use that on the right side to look for the the liver, the edges of the liver, and over on the left side, you can look for the spleen. And then during deep palpation, you can actually feel the edges, the lower border of the liver, and you can palpate the left side for the spleen, but you should not be able to feel it. All right. While you're here, you can go ahead and take a look at the lower extremities. Look at her skin again, of course. Looking to see muscle mass is even on both sides. You want to look for hair distribution, any kind of edema. You want to feel pulses, pedal pulses, popliteal pulses. I don't think I checked the pulses in the upper extremities when we were doing that, so you can feel for radial, brachial pulses as well. Okay, you can go ahead and sit up. You also want to check range of motion for all of the extremities, and you would expect somebody to normally have active range of motion on all extremities, and then you would also want to check back. And you want to check her spine to see if it's straight and there's no presence of scoliosis, so you can have the patient stand up. And just lean forward a little bit and just let your arms dangle. So then you can start all the way at the top, the cervical spine, and check all the way down and make sure that the spine is straight and midline. And let's see here. I think that pretty much covers the head to toe assessment. So thank you.